give you, actually, I'll maybe just start with just a little bit of a flavour from the health needs assessment that we published yesterday. I won't spend too long on this, but just a bit of context about why it's important in terms of mental health support for LGBT young people. So although this is all ages, this is very reflective of young people within the cohort that took part within the needs assessment. So very, very high levels of mental health issues reported in the LGBT plus population, particularly those who are trans and non-binary and those who identify as bisexual. But the mental health outcomes across the population of LGBT young people is not good, particularly the suicidal attempts here. So ranging from a quarter of lesbian and gay women to half of trans and non-binary people reporting suicidal attempts. So we'll maybe send out a bit more information about that needs assessment, but I think it's important context in terms of the services that are provided in Glasgow by our three third sector partners. I didn't introduce myself there, sorry, I just realised. I'm Nikki Coya, I'm Health Improvement Manager for Sexual Health with NHS GGC, and I'm involved through the HSEP in working with the three services that I'm talking about, and I won't do justice to the range of exceptionally good services that they provide. So these three services work with LGBT young people. They are, not surprisingly, young people who are LGBT plus will gravitate towards an LGBT identified organisation. It's a place where they can be their authentic self. It's possibly the first time that they've ever, when they've been in contact with these organizations, possibly the first time they've ever visibly or in a kind of public way identified the way that they feel. And that's particularly important given that I guess the online world that our previous speaker was talking about has become increasingly hostile for LGBT young people over the last couple of years, particularly those who are trans and non-binary. So in terms of these three services, what they all have in common is that none of them are crisis response services. They all provide social connections. They all provide somewhere that validates the identity of people in a normalizing way, and they all provide an element of peer support and probably what you would say is lower tier mental well-being support. So they're not crisis services. They're all self-referral, but also any other worker in any organisation is able to refer young people into these services. So I'll just cover what they individually provide. So LGBT Youth Scotland, or maybe the one that you're most familiar with on the call, the dedicated young people's organisation, work with young people aged 13 to 25. And they provide a series of kind of structured youth work support interventions. So two separate groups that are age dependent for young people who are questioning their gender identity or who identify as trans or non-binary. Yogurt is the one that kind of works with the younger age group, that 13 to 18-year-old, and the Trans Youth Glasgow group is a slightly older 16 to 25-year-old group. There's also the Vibe Zone group, which is a more in the round LGBT plus youth work and support group. So these groups all provide, I guess, peer support, structured group work activities. But in addition to that, the workers at LGBT Youth will provide asset-based coaching models of one-to-one support for any young person that requires that additional support. The modes of delivery right now are a kind of hybrid between face-to-face work from their Bell Street kind of premises, but they've also very successfully, as many youth organisations have, adapted to online delivery, and LGBT Youth Preferred kind of platform is on Discord, where their platform is called Pride and Pixels. And across the week, they will run all these groups, both virtually and in face-to-face. In the evenings, they run a live chat service several evenings a week if there's a young person that wants to just connect in that way first, and that's probably quite a common way into the service to try out what the service is like, and then kind of make the step into the actual service. And then to, I guess, working on some of the kind of the issues around discrimination. A kind of program, the LGBT youth run a program of work around the Charter of Rights, which they run with schools across Scotland, and many of the secondary schools in Glasgow and now a few primary schools are now working towards that Charter of Rights to make school a more welcoming and inclusive place for young people to be. I think that's everything I was going to say on LGBT youth. So LGBT Health and Wellbeing are a national organisation who are probably more recently set up in Glasgow in the last few years. They'll work with people who, LGBT people who are aged 16 plus, although a fair cohort of their service users are in that 16 to 25-year-old age bracket. In Glasgow, they provide two overarching programmes of activity. One is the mental wellbeing project, and there's a series of kind of support groups that run there. The Wellbeing Cafe runs weekly, but there's also a range of kind of more arts-based or creative-focused kind of activities for LGBT plus people, and a bit of outdoor activity as well. So, and that's all designed around peer support, around mental well-being. The other main programme in Glasgow, which is a really busy one, is the Glasgow Trans Support Programme, and that's, as it sounds, programmes of work for people who are trans or non-binary or questioning their gender identity. Again, it's there's an element of one-to-one support, but a significant part of it is the group support. The group support element of that work, and structured workshops for people who are going through the process of transitioning in very practical ways, covering things like voice coaching, clothing, and the very practical paperwork and logistics that are involved in transitioning. LGBT Health and Wellbeing also nationally run a few programmes that are available in Glasgow. So that's the LGBT Helpline, which is both telephone and live chat, which runs at various points throughout the week, which will be on the details that are sent out. And they are also nationally funded to deliver a group that's very active in Glasgow, which is the Asylum Seekers Support Group. And again, that's an area of work that's really grown for LGBT health and well-being, and where some of the mental well-being issues are quite profound. Like LGBT youth and other organisations, they're still in a place of hybrid delivery with online and face-to-face delivery. And last but absolutely no means least is Leap Sports, who are an organisation who take a community development approach to encouraging LGBT plus people to be involved in sport or physical activity, which obviously has clear links to mental well-being, but particularly focused, I think, on addressing those issues of social isolation and connectedness. So again, with Leap Sports in Glasgow, there's a range of activities. So they'll either work with other groups that facilitate sports, like, for example, the inclusive rugby or inclusive sports kind of teams, but there's also kind of more kind of direct support and coaching for individuals who are a lot more hesitant about taking part in physical activity or sport. Get Back Out was a programme that still continues, but was initially about encouraging people who had become isolated and reluctant to leave the house during COVID and needed a bit of support, a bit of hand-holding, I guess, to kind of come back out into society. Trans Active is specifically for trans non-binary people, and Active Buddies is about if somebody needs a bit of mentoring, a bit of direct, someone to check in with, basically, to make sure that your goals are being met. That's a programme that kind of functions on that level. Although they're a kind of sport and physical activity organisation, because they have the connection with LGBT plus people, inevitably they've had kind of additional requests to provide just more direct one-to-one emotional support. And so that's an area of work that as early as last year wasn't really part of the mix, but which the demand for which has grown, and so that's something that Leap Sports are now looking to take forward in a kind of structured and planned way. And the other bit of the other bit of service that is a more recent development for them is the family support service. So LGBT youth, if you remember, work with young people who are aged 13 plus, but obviously, and I work in Sandyford, the service where Scotland's gender identity service for young people is, where there's a significant waiting list for a first assessment. But some young people under the age of 13 demonstrate gender-related differences. And so what Leap Sports do is work with a family support model around that young person who is under the age of 13, and they take a kind of structured support to helping that family undergo what we call watchful waiting. So it's a kind of watchful waiting process for young people at that age. So that's a newer kind of area of activity for Leap Sports. So I'll just very quickly leave you just with some of the outcome kind of quotes from people that have used the services that just outlined there. And although I work closely with these services, I'm thoughtful that had they been here themselves, you'd have probably got a bit of a richer flavour of what's actually delivered. But we'll send out the information after this.